Surgeons of Reddit. What has been your biggest OSPEEP moment? Edit. A lot of sarcastic replies which I expected, however, to everyone saying no surgeons on Reddit, be real here. Everyone uses the internet. Way back in the day, pre-op was done with alcohol-based cleaners. Naked. Sedated guy with a light sheen of cleaning fluid on him, static electric spark fully engulfed in flames. Everyone just stood there for a second till someone grabbed a sheet and put out the flames. Surgery went well. No complications. Slight suntan. Balboa Navy Medical Center, San Diego. Old surgeon. Edit. The original source of this. Via his student, now doctor, my friend. Incident may have happened elsewhere. This one's from my dad. We were putting up a central line for a drip with an 18G needle, 1.2 mm, relatively big compared to most needles in the patient's external jugular. And all of a sudden the needle went right into the jugular. We all started panicking because usually with a drip the needle is meant to come out and only the plastic remains. But now we had lost the needle inside this guy's jugular. Before we could even fish it out, it was gone. I looked at the fellow surgeons and nurses, and before we could do anything we rushed him right into theater. After a few minutes we fished the needle out near his subclavian vein closer towards the shoulder, and we breathed a sigh of relief. I wasn't present for this, but I got to deal with the fallout. Client brings his cat found as a stray to be spayed. The vet, my boss, preps cat for surgery and begins, can't find the uterus or ovaries. Uh-oh. Cat is a male. And poor kitty just had his belly sliced open for no reason whatsoever. The owner was, understandably, furious. I was a junior doctor working in neurosurgery back in 2008 when one of the senior registrars, I suppose the equivalent is chief resident in the USA, told me his most unfortunate moment. In order to have a patient's head stabilized for surgery, he was using a frame that had a set of 3 spikes that held the head in place. Due to the angle he needed to approach from, this required the patient to be face down. As he was placing the head of the anesthetist patient onto the frame, the head slipped and his eye landed onto the spike, perforating the eyeball. Panicking and thinking that his career was now over, he then rather bizarrely started poking at the eyeball, trying to work out what was what, until the anesthetist told him to stop. They then called the ophthalmologist, who came to tidy up what was now a completely ruined eye. After the surgery, terrified, he went to explain to the patient what had happened. Understandably fearing the worst, anger, distress and tears, received the response of, "That's okay, I was blind in that eye anyway. Luckiest bastard ever." TLDR. Surgeon perforates patient's eye by mistake. Patient doesn't care. I woke up during the last part of my gallbladder removal. I felt this pressure, as my surgeon had him for a prior operation. Funny guy was trying to close one of the wounds. I lifted my head. We locked eyes and he had this startled OSPEEP. Look. Then he snapped back to normal. Said, "Patient's up." And the anesthetist was on that SPEEP. Woke up an hour later in recovery. Had a friend with a swollen area on his lower back where it got to the point where he could barely sit. So he goes to his family doctor. The doc says, "Yeah, that's a pilonidal cyst. We should probably go ahead and take care of that." He told my friend to take off his shirt and lay flat on his stomach. So he's laying there and waiting, and the doctor says, "You're going to feel a poke." And is at this point expecting a local. Well, first it turns out the poke was actually a scalpel, not a local. He said it basically felt like someone took a fire-hot poker and drove it into his back. He then hears the doctor exclaim, "Oh boy! We have a pumper." Just as he feels warm blood and pus now pouring all over his back. The nurse's face, which was the only thing he could see, went from a warm smile to what he termed as pure and unadulterated fear, as the doctor is screaming for her to get gauze and towels. The doctor climbed up and laid on his back to apply pressure for about 10 minutes until the bleeding stopped. So yeah, I'm hoping I never get one of those. Not quite a surgeon, but somewhat medical. I was bisecting someone's leg deceased and I did not know that said person had a metal rod through their femur. Proceed to cut through the bone with a metal saw. Sparks fly and my blade broke. Luckily I was standing off to the side, instead of directly behind the blade, as it flew backwards and hit the wall. The clothes the person had been wearing were lying underneath the body and caught a spark. I doused it with the water hose before a large flame could start. But still an oh-speep moment. I doubt you'll get too many real stories. Mine is extremely rare as I was the patient. But awake for the surgery I was supposed to have a bump on my back removed. Nothing huge. Just a lump of some kind. For insurance reasons they did it as an ambulatory in the OR of a hospital instead of the surgeon's actual office. So, I'm wide awake. Face down in the OR. I had picked him as my surgeon because his main practice was plastic surgery. At the time I lifted weights a lot and spent a lot of time working my back. I wanted as small a scar as possible. I was vain. He begins with the first incision. Then goes for a second. Larger. Then goes deeper I guess and realizes the bump is just the extruding tip of a cyst that cut through my back to the back of my lungs. He wasn't used to operating on alert patients. As soon as he realizes he just says, "Oh beep." That was the beginning of a 4HR surgery for which I was awake. What they cut out of me was the size of an adult fist. In closing the wound they drew in so much flesh for lack of a better word because of my lack of medical understanding that my right arm became essentially inflexible. I couldn't lift weights for years. All that precious work shot down the drain. What an asshole I was. Nurse here. I was assisting with a simple vasectomy and the doctor was having trouble differentiating the vas deferens from the testicular artery. I stopped him just before he cut the artery. If he cut that, the testicle would die. Not to mention make a very bloody mess. Also nurse here. We had a young guy get a vasectomy. And they gave him Norco for pain when he got home. Not wanting to feel drugged up on narcotics, he started taking lots of Advil instead. He killed his kidneys within a couple days and came back on dialysis. I broke my wrist once. And the broken bone had to be surgically adjusted so it would grow to be a nice and functioning one again. It appeared to be an easy and uncomplicated procedure. And 2 hours later I woke up with a cast around my arm being told everything went fine. A couple of weeks later I returned to the surgeon who performed the surgery to have the cast removed. As soon as he took it off he had a confused look on his face. I could see him think shit. And he told me perhaps it didn't go exactly as planned. The two parts of the bone weren't placed in a straight line during surgery. So after a couple of weeks in a cast my arm was now really funny looking and crooked. Arm had to be manually broken again and put in a bit more of a straight position. Few weeks and a wicked looking scar later everything was okay again. My mom had gone in for surgery. Because the hospital didn't have what they needed they had to have an essential part for the surgery shipped to them. The day comes for the surgery and my mom is prepped. The OR is prepped. The surgeon took the day off from his practice. And my mom is put under. The part they needed, a fluid I believe, arrived and a nurse said, "We never ordered that." And sent the guy away. This is after my mom was under anesthesia. She said when she was being brought out of it she could see the surgeon losing his speep on these nurses and all them crying from how bad he flipping out on them. Rightfully nurses at that hospital suck. The surgery was moved elsewhere and that was the last time he worked with that hospital. I asked my grandfather, a surgeon of 30 years, this exact question once. He told me a story about opening a patient up to fix something serious with his aorta. It's been 10 years since I heard the story. Details a bit hazy. Anyway, he and the other surgeon, who happened to be my mom's godfather, opened the guy up for this dicey operation and found several significant tumors. Like, well, Speep, this guy is toast tumors. He said he'd never seen so much cancer. They went out to tell the family. Went back in. And as they were trying to figure out what to do, the aorta dissected and he bled out with the two of them shouting and trying to clamp it. He said it was over in seconds. He felt bad, but the guy was facing a pretty painful death anyway. He figured that there was less suffering that way. But secretly I think he was upset that they couldn't save him.